Dr. Daniel Ebroon, and today I'm going to talk a little bit about filler to the lips. So as we age, the volume on our lips starts declining, and we start seeing little finer lines within the substance of our lip on the mucosa. And a really fun thing to do and an attractive thing to do is to put a little bit of filler into the lips. So I want to show you two fillers that we use. Every company makes fillers that are a little bit stronger, a little bit soft and silky. The #1 selling filler in the United States is the Juvederm brand of fillers. They make something called Juvederm Ultra and Juvederm Volbella. Ultra is more strong, more robust. That's used when you want to make the lips noticeably larger. If we want to make them just a little bit more full, something more subtle, but also something to help with the lines in the lips and to help shape the lips, then we would use Juvederm Volbella. So patients who are ready to do filler to their lips might want to think a little bit ahead of time about how to prepare before they come to the office. A simple thing to do is to avoid those things that promote bruising. That means for several days before the injections, no aspirin, Advil, Aleve. Ibuprofen is a form of Advil. And we want to avoid those. Fish oil and flaxseed oil, any omega-3 fatty acids, those are forms of blood thinners too. So if we avoid those, then we minimize the chances of bruising. And usually lips don't bruise that bad, but we still want to do everything in our power to minimize the bruising anyway. The other thing that you might want to think of right before doing the injections is that lips, when we do the injections, they're going to feel funny because they're going to be numb for an hour or two afterwards. And eating and drinking will be a little bit more difficult afterwards until the anesthetic wears off and the numbness goes away. So you might want to consider eating and hydrating yourself ahead of time so that that's not an issue. Once patients come to the office, what we do is we put topical anesthetic numbing cream onto the surface of the lips. Topical cream can really help in this area especially because where the lip mucosa is, it's not as strong of a barrier as skin is. So the numbing cream works better, and if it's allowed to sit for a few minutes, it actually does a very good job of anesthetizing and numbing the lips. And then of course there's filler, the filler itself has anesthetic inside the filler, and so that also promotes numbing and comfort. So when I do a consultation with a patient, we'll discuss, do somebody want something that's more robust and more noticeable, or would they prefer to have something more soft and silky, a little bit more subtle, some fullness but nothing dramatic, something that's going to soften the lines more. And then in that case, we would use Juvederm Volbella. Once we have the right filler picked out, we go ahead and do the treatment. It only takes a couple minutes. The most important thing from my end is I like to treat in the substance of the lip, not so much at the borders. That gives it a more natural appearance to the fullness. But of course, we do little subtle things sometimes at the border to help shape the lips, to help give the illusion that we're widening it in some patients, to improve the symmetry between the right and left side, to give a more prominent Cupid's bow for those who want that. And what we're aiming for in the lips typically is for the lower lip to be slightly more full than the upper lip, because that's just the way the natural proportions should be. We want as much symmetry between the right and left as we can have, and we want the shape and size of the lip to fit one's face. So we take those considerations into account. Like I said, the treatment only takes a couple minutes. We go around and we do it, and then afterwards, the lips will feel numb, and a little bit of that funny numb feeling makes it so that you can eat or drink if you want, but it's something that in a couple hours that'll all fade away and everything will be back to normal. The stronger the filler, the more you'll feel the substance of the filler with your tongue when you're touching or with your fingers. Stronger fillers, it's not going to look lumpy, but sometimes you can feel little lumps or nodules with your fingers as you're going across. That's totally normal. Less so with the soft and silky ones. But even with the strong fillers, after a few days, those little tiny irregularities that we feel with our tongue or with our fingers will just disappear. And really, the entire time it'll look good. There will be a little bit of settling in the first day or two, so there'll be a little bit where the lips come down slightly, and that usually takes 48 to 72 hours. Anyway, I hope that that's a good little primer on how we do lips and how we think about lips, and I'd encourage you to keep it in mind because it's a really fun thing to treat.